I'm Bill Kauffman. I'm the under 65 sales manager here at Nishlausen Fleming. I just wanted to spend a little bit of time with you today to go over some different products that we would have for not leaving the spouse behind. So to give you a little bit about background about myself is, as I said, I'm the under 65 sales manager. I work directly with agents on any training for products, services, understanding all of the carriers that we have, along with their portals and product opportunities that they serve as well. One other thing that I do here is our under 65 and compliance in general. So that would be any compliance questions that you would have as an agent for Medicare or under 65, along with carrier compliance or any internal trainings that you're thinking about doing with your staff. So some considerations that we want to think about with not leaving the spouse behind. A couple questions you want to ask yourself. Is your client turning 65? Is the client coming off coverage to go on Medicare? Is that client's spouse under 65, and does the spouse need coverage? So one thing with that is if your spouse or if the client's spouse is not 65, say they're only 62 or 63, what options do they have at that point in time is what we want to be looking at. So what I'm going to do is go over some different products that we do have here that we can offer you to offer to your client that I think are going to be a great asset to actually help your clients in general. So as you can see, we do have ShortTerm Medical, something called Tri-Term Medical. We have our ACA plans, and we do offer some ancillary products as well. First one that I want to talk about is going to be our ShortTerm Medical and Tri-Term Medical. These two products are with a new carrier that we're now offering, which is UnitedHealth One. They are part of the United Healthcare Network, which is one of the largest networks in the country, and they offer the largest in-network discounted pricings. The one nice thing about this product also is that they are offered in multiple states, so we're not looking at just a one single state here. We have a variety of states that this product is offered in. With short-term coverage, one of the things that I think this is going to be the best for a lot of the clients out there for their spouses is that this is a product that's offered from 1 month up to 12 months. So if you do have that client that's turning 65, going on to Medicare, and they have a spouse that's 64 and a half, this is the perfect opportunity for them to cover that gap. So one thing about the short-term coverage, again, is you do have that 1 to 12 month period. You are looking at a flexible portfolio here with multiple plans that are being offered. You have multiple deductibles that range from $1,000 up to $1,200 and $500. You have co-insurance that can range from 60-40, 80-20, and sometimes even a 70-30, excuse me, and different premium choices for that. Again, the biggest thing that I want to hit here is the strength of the network. You do have that network that is a nationwide coverage. Again, just a few points on this product. So again, the national coverage, you have that throughout the entire United States. You have over 1.2 million healthcare professionals. That's a lot of doctors and nurses that the clients will have at their disposability. And then approximately 6,500 hospitals that you will have to work with throughout the United States. The other product that I want to discuss with you, if short-term is not an option, would be our Tri-Term Coverage. Tri-Term Coverage is up to 3 years. So what that is that's a one-time application that you would have to, or that the client would have to worry about. After that one-time application, they would have up to the 3-year coverage on that at their disposability. The one big thing that I want to point home with is that after 12 months is when pre-existing conditions would be covered. Your first year would not be covered for the pre-existing conditions. So we are looking at fairly healthy individuals for this product just because of that 1-year clause that they have on the pre-existing coverage. But otherwise, this coverage would be fully preventative care, doctor office care, and prescription coverage. The one thing that I want to take a look at with this is basically looking at this as a pre-ACA major medical plan. For any of you that were in the business prior to Obamacare and the coverage that existed prior to that, with regular health insurances, that's basically what this plan is. Tri-term will only be a simplified underwriting, so it will only be yes or no questions for the clients. So nothing major that they'll have to worry about, simple yes or no. You can apply anytime. There is no OEP or SEP coverage that you have to worry about for the enrollment period. And if you were writing this fairly late in the month, say the last day of the month, they can have coverage the following day on that. So you're writing coverage August 31st, September 1st, they can't have an effective date for this coverage. So it's a great turnaround period with no waiting time for that client. One other product that I want to hit on with UH1, this can be a standalone product or they can add it in with their short-term or tri-term care. And that's what we call Healthiest You. Healthiest You is basically going to be a telemedicine product for them. So with this, you'll have consultation with a general practicing doctor 24/7, just as you would with any telehealth. This can be done directly over the phone or via a mobile app through UH1. With anyone that subscribes to this, they will have prescription coverage that can have savings up to 85%, which is a huge deal in the market today. And the biggest thing that I want to point on with this is that it's only $20 a month. That $20 a month can cover an entire family. So say it's a family of 5 that's taking this as a standalone product, that $20 a month will cover every single member of that family. So I think that's a huge deal in itself just for this product. One other point that I want to make, and this is going to be primarily for our PA agents, for the PA clients out there, and that's going to be our regular ACA individual market plans. These are going to be your traditional medical coverage plans with multiple plan options available. They will be offered through Highmark and UPMC in PA through Neischloss and Fleming. We will have our open enrollment coming up, which will begin November 1st. One thing that is changing this year is instead of us using the federally facilitated marketplace, we will be using a new state-run marketplace called Penny. This marketplace had pre-registration open already. Once you are pre-registered, we will receive later notification about certification process and what the next steps are. One thing that Pennsylvania is doing this year is they are going to extend open enrollment from November 1st up until January 15th now. What that allows is for anyone that signs up from November 1st to December 15th, they'll have an open enrollment date of January 1st, 2021. Anyone that misses that first section can still enroll from December 15th through January 15th, and they will have an effective date of February 1st, 2021. The ancillary products that we have for any of our clients, whether they are on a short-term, tri-term, regular ACA plan, these will all be available for them, and that would be some plans such as dental, vision, hearing, hospital indemnity, and many more that we have to offer for them. So if you are looking for any of those products for the clients, please let me know and we can discuss those in further as well. If you do have any questions in regards to any of this information from any of the products that are offered, any questions in general, please don't hesitate to reach out to me. My contact information is available for you here, from my phone number to an email address if that's easier for you, whichever you would like to discuss with me. Please feel free to reach out to me at any point in time. I'm here for any questions, concerns, to help you with this process completely. Again, I want to thank you for your time today. Any questions that you do have, please reach out to me. I want to be here so you have a great OEP this year, and any concerns, questions, anything like that, please reach out to me.